This is your permission slip to speak your truth, own your story, and laugh through the chaos. Welcome to the Transparently Jordan podcast.
This is Radiant Voices Media.
Certainly for very mild levels of acne, trying some over-the-counter measures is it can be absolutely appropriate. But I think people sometimes feeling like it's their fault or there's something wrong with their skincare. I mean, if someone's got cystic acne, skincare's not going to fix it.
Hey everybody, and welcome to another episode. In today's episode, I am joined by Dr. Aakriti. She is a highly accomplished dermatologist in the field of medical and cosmetic dermatology. She possesses strong academic credentials, extensive specialty training, and a commitment to research, education, and leadership in cosmetic dermatology in Australia. She is Adelaide-based, and today's episode, we chat about skin, we chat about sun, we chat about aging, hyperpigmentation, preventing aging, so much in today's episode. It is jam-packed. I am super excited for you all to hear it. Without further ado, welcome Dr. Aakriti, and let's get into today's episode. Well, thanks again for coming on. Morning was well, so that's good. It's a beautiful day here in Adelaide today. Aakriti, maybe if you don't mind, just getting started with telling the listeners who you are, and we can kind of go from there.
Yeah, of course. Thanks for having me on today, Jordan, as
That's
well. So my name's Aakriti Gupta. I'm a dermatologist based in Adelaide. I did most of my training in Adelaide. I've also worked in Melbourne, but primarily based here. And I work both in private practice as well as I'm also visiting medical specialist at the Royal Adelaide.
Awesome. Alrighty. Well, I think the reason why I wanted to have you on was, of course, the dermatology space and skin. I think it's such a prevalent topic in a lot of people's lives, and it can be a sensitive topic, I think, as well. And I think people will get a lot of goodies from this episode, and kind of, I guess tips and tricks. That's kind of what I guess the aim of the episode is. But maybe let's get right down to it. What do you think the most misunderstood thing in skincare or in the skin is these days? Because I think that's a loaded question, I know, but I think with social media and people get information from everywhere these days, and you hear so many things out on the internet and whatnot. But what are some things that people come to see you for, and is kind of like a misconception that you have to educate them on?
Yeah, I think there's a few. I think surprisingly, in some ways, one of the things that still remains tricky to get across is the importance and the level of sun protection needed, especially in Australia. So I still get lots of questions around sunscreen use. And this very much does need to be a daily thing all year round in Australia because it's always about your UV radiation rather than just about whether it's sunny or cloudy. I think we are getting better at it, but I think where people still often really struggle is understanding the importance of reapplication. So particularly, I mean, obviously if you're indoors all day, you may need to reapply, at lunchtime before driving home. But, if you're going to be out and about, and particularly if people are prone to pigmentary disorders, reapplying, really every 2 hours to prevent pigmentary issues from progressing can be really important, and combining that with lots of other elements of sun protection, whether that's, hats, sunglasses, long sleeves. So that's probably one thing that I think is key.
Yeah. Because you hear a lot of the times people forgetting to wear sunscreen all the time, or like, oh, I know I should, but I just don't, or whatever. So what are some ways that you educate people on tips on how they can be smart to apply it and reapply it? Because, if you're, let's say, a female and you have makeup on, it can be quite difficult. If you're a male and, you're working out in the sun all day, it's important to reapply. So what are some ways people can reapply?
Yeah, that's actually a really good question. So I'd always advising putting it on first thing in the morning, like a good layer. But then for top-ups, particularly for women that are wearing makeup, often you might start in the morning with a mineral-based makeup, but then maybe a mineral-based sunscreen, but then maybe during the day using something that's a lot lighter that they can put on top of their makeup without disrupting the underlying makeup. And there's lots out there now. Like sunscreen doesn't have to be greasy. It doesn't have to feel yuck on your skin. And I will always give them like written recommendations and samples if we have them about things they can try so they can find something to work for their skin. Same goes with males. There's a lot of there's a bit of trend towards sort of sunscreen sprays and things, which I think are okay for top ups. I still think they're good in terms of it's definitely better than nothing. But I think always if you're going to be outside or if you are going to be spending a chunk of your day being out and about, I think it's really important to still put on a good, decent layer of a cream-based sunscreen.
Right. Okay.
Yeah.
What about the different types of protection like SPF and whatnot? Because sometimes people get like moisturizers that have SPF like maybe 15 included or whatnot, and again you hear information about how that's nothing or that's not enough, and so what do people need to worry about when it comes to that?
Good question again. So SPF is it's called sun protection factor, and it partly relates to the individual skin type because it's almost like a multiplication of. So say for example, just hypothetically, like say a given person without sunscreen, say it took them 10 minutes in the sun to burn without sunscreen on. If they had something with SPF 15, it would probably take about 15 times as long for them to burn. If it had SPF 50, probably 50 times as long. So that's why there's a relationship also with the person's underlying skin type. I think in Australia, but partly because our UV index is quite strong, it's probably better to go for an SPF 50 plus sunscreen. Just often because people often don't apply as much as they probably need to get that SPF 50, because often when they're tested, when sunscreens are tested and regulated, often the amount that's being applied in those studies is a lot more than people tend to apply. So I feel like even if they're putting a little bit less on, at least if they're putting on SPF 50, that's going to give them better protection overall. And probably the other thing to look for is broad spectrum. So that broad spectrum means it covers both UVB and UVA, so not just UVB, because SPF is referring to UVB protection, but it's not referring to UVA.
Right. Okay. Yeah, because I hear that Australia has some of the highest like testing regards and like stuff for sunscreen. So that's probably good.
It's really good. Yeah. So all sunscreens in Australia have to be approved by the TGA. So the Therapeutic Goods Australia, very different to cosmetics that don't have therapeutic functions, which are more regulated by industrial chemical standards. But yeah, Sunscreen Australia are regulated by TGA, and they do have quite strict guidelines about that.
Right.
Yeah.
So I guess you know what you're getting when you're buying a sunscreen. You know it's kind of, the SPF 50 or whatnot, and it's not just a marketing kind of tool. That's good to know, I guess, for consumers, because you look on the shelves these days and there's like 50 choices, and I think it's sometimes hard for people to choose and decipher what's good and what's not. What about skin types and skin tones? Do people, let's say with like lighter complexions or darker complexions or whatnot, do they need to worry about different things at all when it comes to sunscreens or when it comes to the sun?
Look, I think everyone's got different I guess everyone has different issues when it comes to their skin and sun. Like for example, generally lighter or fairer skin types will be more prone to sunburns, and for many types of skin cancer, more prone to the development of skin cancers. Darker skin types with sun exposure, obviously we still do see skin cancer in darker skin types, although admittedly not to the same extent, but they can sometimes be more prone to issues with pigmentation, for example. So I think sun protection is important and relevant to everyone. I guess there's also aspects related to aging as well. So obviously UV remains the number one modifiable factor in terms of skin aging. So again, that's relevant to all skin types. So I still think it's relevant to everyone. But yeah, you are correct that there's different aspects of UV exposure that may be more important to people with different skin types.
Okay. All right. And maybe go back to what you just mentioned when it comes to like sunscreen and when it comes to people's like aging and things like that, and just the sun in general. What kind of things do people need to be aware of when it comes to the sun and harms that it can do for the skin or our skins? Is there things that people need to be concerned of? Like, you outlined it's aging, and can it affect pigmentation, or can it affect other things like that?
Yeah, definitely.
Okay.
So, from a science point of view, sometimes I think about it as like UVB like B for burning. So UVB is more likely to cause a sunburn. And then UVA as A for aging, because that tends to penetrate a bit deeper. So it tends to be more responsible for some of the aging effects that we see. Both forms of UV certainly contribute to DNA damage and risk of skin cancer. So that's across that spectrum. In terms of effects, I mean, there's been lots of interesting studies that have been done looking and trying to where possible isolate the effects of sun on aging compared with sort of what's normal or chronological aging. So people who have had greater exposure to sun tend to have coarser wrinkles, certainly can get various pigmented spots ranging from things like freckles to what people often call sunspots, which are like little brown flat lentigos is what we call them medically. And the skin's often a bit drier, it can feel coarser, it tends to break down our elastin fibers a little bit more as well, so it can contribute to changes in skin elasticity and texture. So that gives you a bit of a broad view in terms of some of the changes that we see in terms of sun, and particularly its cumulative dose in terms of skin aging.
Is it permanent? Like when people get to that stage, they forget to wear sunscreen, or, the elasticity changes and whatnot. What can people do to help prevent that, or to help, I guess, sunscreen to prevent that? But when it gets to that stage, what can they do to help fix it, or is it too late?
Good question. It's usually when they come see me.
Yeah.
So, I mean, there's a range of things. Sometimes, to some extent, you can use some prescription treatments, like, retinoids and things can come into play. A lot of the time, it relates more to some of our energy-based devices, like our lasers and things that we use to help stimulate collagen production and repair as well. So it's it's much easier to prevent than to repair. But yes, all is not lost if there are some changes. There's certainly things that we can do to help with that as well.
All right.
Yeah.
Well, that's good to know for people, because I think, like I was saying, a lot of people probably just forget, or they just choose not to for whatever reason, and that's when they come and see you, because it gets to that point where they're like, oh, I need to do something. What are you excited about in the skin space? Like, is there anything lately that's come up with research, or anything that you do in clinic? What are you kind of working on, or what are you excited about when it comes to treatment?
I think there's lots happening in dermatology. I think one of the things that we've become better at over the last few years is combining treatments. So one of my sort of interest areas is laser and cosmetic dermatology. And so I think being able to combine both different devices, as well as sometimes prescription treatments, or what's known as transepidermal delivery, which is when you've sort of used a technique like an energy-based device or microneedling or similar, and then sometimes used an active ingredient to help penetrate through that skin barrier better for its effects. I think being able to combine and optimize different modalities to get the best results for patients, I think, is becoming better understood and researched, and that's probably a space that I find really exciting.
Right. Is it, I don't want to say the term better, I don't know if that's the term, but, are there better benefits using multiple modalities like that versus just a single one?
Yeah, look, it depends very much on the problem that you're treating and the person's skin type. So, but I guess a good example would be for something like acne scarring, for example, where people often have different types of acne scars, different depths, different shapes. And it's very uncommon that a single type of treatment, like one laser or microneedling or one thing alone, will be enough to fix it. So I think the ability to be able to combine it, I think people have had different treatments over the years, but I think we're now being able to do more in a given session as well. So that's quite exciting as well.
For sure.
Yeah.
And I'm glad you brought up acne, because I think that's a very common thing for people, even in adulthood. I think it's something that maybe you struggle in when you're in your teenage years, and then you still into young adulthood or whatnot. What are some common, I guess, issues that you see people come into you with when it comes to acne, and what are some strategies that you can help with?
Yeah. I think sometimes, I mean, acne is such a visible problem, and often in quite in an age group. I mean, it can happen obviously across different decades, but obviously it tends to be most common in our teenage group. I think in teenagers we probably say about, between 85 to 95% of teenagers will have acne at some point, right? So it's super common. I think things that people worry about is, often I'll see people in their sort of late 20s or early 30s who are like, shouldn't I have grown out of this by now? Like, why am I still having breakouts? And I think understanding that, yes, although the peak group still tends to be like people in their late teenage years, we absolutely do see it in people in their 30s or even sometimes 40s, and that doesn't mean it's abnormal per se, but there's definitely things that we can do to treat it. And I think certainly for very mild levels of acne, trying some over-the-counter measures is it can be absolutely appropriate. But I think people sometimes feeling like it's their fault or there's something wrong with their skincare. I mean, if someone's got cystic acne, skincare's not going to fix it, And I think not being reluctant to seek medical advice or medical opinion about what options they have, I think is really important too.
Yeah.
Yeah.
Are there like underlying causes for, let's say, different types of acne? Like, are some people more prone to cystic acne or prone to other levels of acne, or how does that all work?
Yeah, I mean, there is obviously there's a bit of a genetic component to it. So certainly people that have cystic acne, it tends to be more common in people that have a positive family history of that too. There are some medical problems that can predispose to acne. So, for example, probably one of the best known ones in women is underlying polycystic ovarian syndrome. It doesn't necessarily mean they're going to have cystic acne. It just means they might have acne that's a bit more persistent or recurrent. So that can be important to identify. But at the end of the day, the actual process or the pathogenesis of acne is quite similar, and there's a lot of overlap in terms of our treatment ladder when it comes to acne.
Okay. And I know you were saying that, like, people come in and they think, oh, is it my fault or whatnot? But does lifestyle or food or stress or anything like that affect acne at all? Like, can that help people at
Yeah,
all?
I think so.
Okay.
So I think, I mean, in terms of skincare, I think it's important to, in people that have acne-prone skin, generally to try and use the lighter sort of oil-free moisturizers to avoid occluding the follicles. In women, I'll sometimes suggest mineral-based makeup may be preferable just because it's a bit less likely to block the follicles. Also thinking about things like hair products and things, particularly if you've got acne sort of that's extending up onto the forehead line. So those things can be useful to have a think about. From a lifestyle perspective, look, the data between in terms of diet and acne is a little bit mixed. Probably the things that have the most evidence would be foods and drinks with a high glycemic index. So foods and drinks that release sugar quickly, and that can include things like, white breads, rice, pasta. Those things are known that they can aggravate acne. There are also some reported associations with whey protein, which is relevant to a lot of people that are working out a lot, and possibly with skim milk. But I don't want to demonize dairy in general. It doesn't mean you need to cut out dairy. It's just there's possibly a limited link with skim milk.
Okay.
Yeah.
What are some tips or things that you help educate people with when it comes to acne? Like, what are some strategies and ways that you help with when it comes to people needing to get over their acne? Let's say you have a 25-year-old that comes to see you. They have a history of acne. And what are some ways that that you kind of help them kind of get over that spell?
Yeah. So, I mean, realistically, by the time someone's coming to see me as a dermatologist, the vast majority are looking at prescription treatment. I mean, often they've tried sort of a lot of the over-the-counter measures, or they've tried initial measures with their GP. So by the time they see me, often it is about instituting prescription treatments, and there's a range of options there. Other things that we do talk about lifestyle like we have just now, and how to reduce risks of recurrence. We do talk about their skincare and how to optimize it, and that might be different whilst they're on prescription treatment compared to when they're more in the maintenance phase. The other thing, as we talked a bit about earlier, is also assessing to see if there's any element of acne scarring. Because obviously if there's scarring present, then in addition to prescription treatment, we may well need to address that with other devices to help people actually achieve clear skin, because it's not just about getting the acne under control, it's about getting their scarring sorted, so they feel as if their skin's as clear as it can be and they feel good about themselves.
Yeah,
Yeah.
and that's the thing. I think
Yeah.
skin is, like you were saying, it's visible. So I think
Yeah.
a lot of people, like, it affects your mental, like, outlook of yourself and
Absolutely.
everything, and
Yeah.
it's such an important thing. So, to help them with scarring, I think is
Mm.
is so interesting.
Mm.
What are some non-negotiables when you are like discussing skincare with people? What are some
Mm.
non-negotiables or things that, or maybe misconceptions, things that people are often using? Let's say that they have acne prone skin or whatnot, and they're trying to use all of these topical things. What are some things that you're like, oh, maybe let's stay away from that? Or is
Mm.
it very individual
I think it is
based?
quite individual.
Okay.
I will just say sometimes people sort of try and really dry their skin out. So they'll avoid using moisturizer when they have acne prone skin. And oddly enough, so our sebaceous glands, the glands that make oil, uh, if there's it sometimes paradoxically will stimulate the oil glands to make more oil if you haven't moisturized, if you think about it, because they're now like the skin's so dry.
That makes
So
sense.
yeah,
Yeah.
so you've got to get the balance right. Like yes, you can use a lighter moisturizer, something that is hydrating but not, oily or sticky, but it doesn't mean you should avoid it altogether, for example. But as I was saying before, it is a bit individual because it also depends on what our plan is for their acne, because sometimes um, if we are using prescription treatments, it might be that their skincare routine is really quite simple and more about supporting the skin barrier. Whereas there are some cosmeceuticals in the market that can be useful when people either have milder acne or are more in that maintenance phase.
Right.
Yeah.
So, what are some non-negotiable, I guess, skincare products, whether it be moisturizer or different topical things that you often recommend to people? Let's say, like, just for anybody, acne, no acne, or whatnot. What are
Okay.
some things that people should be doing?
Yeah, so I mean, in general, obviously, make sure they've cleansed, especially at the end of the day, to wash off any makeup, sunscreen from the day. A good moisturizer to help support their skin barrier, and obviously sunscreen in the morning. Beyond that, it depends a little bit what their skin goals are and their skin type, and whether or not there are any issues that we need to address. So there's lots of minor things that trouble people. You know, when I say minor, I mean they might not be need medical intervention, but their skin may be a little bit more prone to pigmentation or might be a bit prone to redness, or prone to acne. And so we factor that in when we think about their skincare plan. So, for example, like vitamin A, different forms of it, like retinols, retinoids, can be really valuable in terms of supporting collagen production and having some anti-aging benefits. But there are patients who have very sensitive skin or rosacea prone that may not tolerate it. I sometimes talk about, the ABC of skincare, so A being vitamin A, B being vitamin B3 or niacinamide, and C being vitamin C or ascorbic acid. And that doesn't mean that everyone's going to use all three of those, but it's a useful way to think about the different ingredients that are out there. Niacinamide, I recommend to so many of my patients because it's got so many benefits. It does have some anti-aging properties, but also anti-inflammatory, anti-redness, anti-pigmentation properties that can be tolerated by the majority of skin
Yeah.
types,
Yeah.
depending on the formulation. So
Right.
I guess that gives you a little bit of an
Yeah.
overview about some of the things that we might discuss.
Yeah.
We often try and, also have a talk about things that might be a bit more intermittent, like, the exfoliating once or twice a week, or whether we do that, or whether we do, any in-clinic treatments to help optimize their skin
Right.
as well, and how we might modify their skincare routine in and around that.
Yeah, awesome. Yeah, because I guess it is individualized to everybody, and taking this with a grain of salt to everybody listening. But I think it's important, like, just to, because again, a lot of people maybe come see you or dermatology when it gets to like such a like an end stage of things, but what's to say that they can't see you for like prevention or things like that, right? I guess like you are the specialist in that space, so sometimes it's easier that way than seeing a GP for everything, really. what are some like misconceptions when it comes to ingredients? Like, is there anything in the research right now when it comes to ingredients for skincare that you need to maybe watch for? Or because I think that's very like you scroll through TikTok or Instagram and you see like so many people, oh, stay away from this, stay away from that. But you know, I'm always kind of like, well, if you stayed away from all of this, then you'd have nothing to use. You know what I mean? So, is there anything that the research actually leads to, or is it more so like take it with a grain of salt?
Yeah, look, it's a good point. I think there is this big sort of drive or a lot of marketing around natural skincare. And I think this is a tricky one to discuss, but I think the first thing to understand is that the word natural skincare is often a marketing term rather than it being something that is well defined. In general, though, people are generally referring to products that have ingredients that are derived from resources like plants and things, etc. I mean, if you think about it logically, the vast majority of what we see is derived from environmental sources. Yeah. And as we talked about earlier, even with natural skincare, in Australia, cosmeceuticals generally tend to be regulated as industrial chemicals. And that's because of the processes that are used to extract those ingredients from their sources. But I think breaking that down a little bit and understanding that just because it's natural doesn't mean it's good or bad. So, for example, there are ingredients that can be found naturally or synthesized. So iron oxide pigments, for example, which are often in cosmeceuticals, they tend to be synthesized because there tends to be higher rates of toxic chemicals when you derive it from natural sources that need to be eliminated. So it's not necessarily about where it's being sourced from. It can be about the ingredient. Similarly, things like, as you were talking a bit about earlier, like, you know, products will, it'll be like no parabens or no this and that. But for example, parabens, I can't remember which year it was in, but they were labelled as being like the non-contact allergen of the year because they're so unlikely to cause a contact dermatitis unless they're being applied to broken skin. So I think sometimes ingredients do get a bit demonized without always good reason. And similarly, you know, some of the natural skincare has got really high rates of various botanical ingredients and often they are fragranced and people can have, there are actually quite high rates of both allergic and irritant contact dermatitis from those. So I think that's probably a term that is a bit sort of tricky, and I think more understanding of what you're actually putting on your skin in terms of the ingredients is important rather than necessarily a label about whether it's natural or not.
Right. Yeah. Right. What about fragrance? Like, is that something that people need to stay away from, in your opinion, or is it very like, can people who have sensitive skin like react quite highly to fragrance?
Yeah, look, it is probably one of the things that so it depends. I mean, there are lots of people with normal skin who don't react to having some fragrances, either in their cosmeceuticals or perfumes, for example. But certainly in some of the population that I see, and that can particularly be with people who do have sensitive skin or rosacea-prone skin, or if their skin barrier is compromised, often we will, at least for a period of time, recommend that they use non-fragranced products, just because it is probably one of the, like, it is a potential allergen, and someone's more likely to develop sensitization to it if they are applying it on broken skin. So that's, I don't know if that helps to answer your question. Sometimes we will actually test for it. So for example, if people have persistent eczema and we're struggling to get on top of it from a prescription point of view, sometimes we'll arrange a process called patch testing, and that can see if you actually have an allergic sensitization to certain fragrances. So that can be useful for some patients, but it's not as though that's something that we need to do for everyone. And yeah, sometimes more practical advice, like having a period of time whilst your skin barrier is being repaired where you stick to really simple fragrance-free products, it can be really beneficial.
Right.
Yeah.
When it comes to hyperpigmentation, we alluded to this before. How does that happen? Like, how does it occur and the changes of the pigment and whatnot? Like, what's the science, I guess, or in layman's terms for people listening, how does that all work?
Yeah. Okay, so pigmentation is a broad topic and there are so many different types of pigmentation. I think one important distinction is whether it's a pigmentation disorder or whether they are pigmented lesions. So, for example, sometimes when people talk about, I've got so much pigmentation on their skin, but actually what they have is lots of freckles and lentigers, which are those little brown little growths kind of on their skin, and they're often flat. And so there's very little role for prescription treatment there. Like, it's very much in the territory of usually our like pigment lasers to help manage that in the right person if that's something that they want to address. And on the flip side, we have disorders which are associated with more production of pigment. And that can range from things that are super common, like melasma, which we probably see most commonly in women, especially during times like pregnancy, breastfeeding, if they're on the oral contraceptive pill, etc., because there's hormonal factors at play. Post-inflammatory pigmentation, which is when the skin's been inflamed. That can be from many things. It can be from something like an insect bite, but it can also be from acne. And temporarily, there's an increase in pigment production by the skin's pigment cells, which are called the melanocytes. And then there are a range of other medical diagnoses that are also that can cause pigmentary disturbance. So, I don't know if that helps to sort of at least understand that there's different types of pigmentation, and it's really important to have that assessed properly because, like I said, in the setting of, say, for example, melasma, often we may well start with a prescription fading cream and topical treatments first, very much, and obviously really good sun protection. Whereas, layers and things tend to be third, fourth line for that often. Whereas for, say, the person that comes in with sort of these brown sunspots, provided none of them look dangerous and none of them need to be biopsied or, cut out, that we might instead start with a laser or energy-based device. So there's different, it's important that, the pigmentation's assessed accurately before going down a treatment pathway.
Right. And I appreciate that because I think a lot of us, like, I maybe it's me being a physio as well, because in my space it's very similar, but like a lot of us, if I had, let's say, dark spot on my skin, I'd probably hit Google, which a lot of people do. And I would have never thought of looking at pigmentation in these different ways, which a lot of people do. So you walk through the aisles, you see something labeled, this is for hyperpigmentation or for pigmentation, and you try that and it doesn't work, right? So I'm a big believer, like, see a professional, get it assessed properly, because again, like, a lot of us aren't trained in these kind of areas. So it's good that you broke that down, because I would have never thought of like looking at pigmentation that in those different ways. But how does laser work, or how does that kind of help, or what's kind of the process of laser therapy when it comes to pigmentation or when it comes to just skin treatment?
Yeah. So there's different types of lasers. When we're talking about disorders that are about color, so for example, pigment or rosacea, like redness, the group of, like, there's different types of lasers and they have a specific target. So the target is called your chromophore. So for example, when it's pigment, generally the target chromophore is melanin, which is the type of pigment in the skin. And then in contrast with when you're treating disorders where redness is a prominent feature, the target tends to be within, like, the hemoglobin, or what's in our red blood cells, for example. So that's the target there. And so what tends to happen is that you're using lasers that emit a particular wavelength, and that is selectively taken up by that target in the skin, and it tends to be converted to heat. So, and in doing so, it can help to break down your target in order to allow healing. Does that make sense? Yeah. And then you have different categories of lasers which are more for resurfacing, which is relevant for rejuvenation or scarring, which is quite different, which is really when you're trying to create like a very controlled injury to the skin, like little micro zones of thermal damage, and in doing so you help to stimulate a healing response that stimulates collagen remodeling, can help to even out skin texture, for example. So there's lots of different types of devices, and what you choose to use and the settings that you use depends on what you're trying to achieve.
Right. What
Yeah.
about home therapies, like those light mask things? Because
Yeah.
those are so common these days,
Yeah.
and they're all over social media as well.
Yeah.
I know
Yeah.
Kmart just had, I don't know, a sale or something on these like what is light therapy, and why are people using these red light masks and things like that?
Yeah, good question. So these are LED masks, so not lasers, they're LED masks. And look, there is a bit of data behind them. There are actually different types of LED masks. So you're absolutely correct that one of the most common is red light, but there are other types like blue light and things that can be used too. Most of the time I don't have a problem with people using them. They can help a bit with skin cell turnover or have some mild sort of anti-inflammatory effects as well. So some people rave about them and feel like their skin, glows a bit more when using them regularly. But obviously these are over-the-counter devices and obviously don't quite have the strength of in clinic-based treatments. So I think understanding what they're good for and perhaps what they're not going to address is useful as well. So obviously, if someone is using it more to help complement their skincare routine, I think it's very unlikely to do harm and may do some good. But obviously, if someone has, like significant acne or scarring, I mean, your at-home mask isn't unfortunately really going to make a huge difference there.
Yeah. Okay. Yeah, because it's so. I think it's so common these days, like for people to have those, and again, you hear people rave about them, but I always wondered, like, what are they like? Do they help or not? And I guess it's one of those things where, try it or whatnot. But like you were saying, it's non-clinical, right? So it's probably not as strong. And what can it do for like $50 at Kmart? That's my whole thought process of it.
Yeah, and there's different qualities, obviously, as well.
Yeah.
They're not all equal. So, but sometimes it can absolutely complement, like I said, a person's at-home skincare routine.
Right.
And there are those who've seen some benefits from it too. So I'm certainly not against them, but I think it just depends on what you're trying to achieve with your skin and what your skin concerns are.
Yep. Goals are key, everybody. We are coming to winter here in Adelaide.
Yeah.
When it comes to like dry skin and peeling skin and things like that, what are ways that people can help, or what are some ways that people can, feel more better in their skin? Because again, like everything becomes chapped and dry, and even people with like using moisturizer and whatnot, I think sometimes can struggle. So what are some ways and strategies people can help?
Yeah, and I think you do often need to adapt to your skincare routine depending on the season. So, and this is probably not just in terms of face skin, but body skin obviously as well. So often, certainly in the winter months, I think people often do tend to switch to more hydrating cleansers, or can benefit from switching to more hydrating cleanser. So rather than a foam cleanser, perhaps a cream cleanser or similar can be useful just in helping to support the skin barrier. In terms of the moisturisers, again, you might pick a heavier moisturiser, so something a bit richer. You're often looking for things like ceramides, which help to, repair the skin barrier function. Hyaluronic acid's another useful ingredient when it comes to hydration. So hyaluronic acid is a bit like a sponge in the skin, so it helps to attract water to it, so it can help to hydrate the skin, and that might either be incorporated into moisturiser, or you might actually add in a dedicated hyaluronic acid serum on the face, for example, if hydration is an issue as well. But yeah, those would probably be the main things. So and also just trying to avoid things like over exfoliating and things as well, because sometimes people think that because it's dry that they need to exfoliate the dry skin off more, but still usually for most people exfoliating no more than once or twice a week is still generally the recommendation. Just because otherwise over exfoliating can actually damage your skin barrier too, especially if it's done done quite intensively. So I think cream or other hydrating cleanser, a richer moisturiser, looking ingredients like ceramides and hyaluronic acid are probably some of the key ways to help combat some of that winter skin dryness. Right. Yeah.
What about sensitive skin? Because you hear people like my sister, for example. I remember growing up, and even now sometimes, like she barely uses products, because I feel like there are some people like her who she tries a product, her skin breaks out or becomes red, or she's just like so sensitive to things. So what are sensitive, like people with sensitive skin, what do they need to watch out for when it comes to ingredients or skincare or just putting things on their skin? Because
Yeah.
it could be a common thing, I reckon.
Yeah, and I mean, again, it's going to be really individual because there are so many things that, because obviously sensitive skin is not a diagnosis per se, it can absolutely be a feature of certain skin conditions. So sometimes it's worth getting it checked out because, for example, patients that have rosacea often have skin that's more sensitive to different ingredients and often need to have a really sort of simple, gentle skincare routine. In general, for people that have sensitive skin, you usually just advise using a really gentle, bland cleanser, a moisturizer without too many actives and things in it. Something that's going to help to repair the skin barrier. These patients still do need, again, sun protection because UV, if anything, is going to further cause damage to the skin, right? So they still need to use sun protection. I often say to people, it's hard always to sort of recommend one skincare because different things are going to suit different people. So test like doing a bit of a patch test on yourself can be useful too. Like say you're trying a new moisturizer and maybe either trying it, on the inside of your elbow or possibly on your neck for a few days before you think about putting it on your skin. Just practically, if you've read lots of things before, you want to try and minimize that cycle as well. And then obviously there are certain ingredients that people just don't tend to like with sensitive skin. Most will tend not to use like vitamin A based ingredients like your retinols and retinoids because we know that they are ingredients that are more likely to irritate the skin. So it makes sense that if you know that you have sensitive skin to generally avoid ingredients like that. In contrast, there are ingredients that may suit people with sensitive skin, like tocopherol, which is a form of vitamin E, which can be quite soothing. There's certain forms of vitamin B, like niacinamide, which can actually be quite soothing as well. And it depends a little bit on the formulation as to whether or not it will, suit the individual person.
What about age? So when do people need to start worrying about the skin or, is there a certain age? Because nowadays, you have 12-year-olds in Sephora or, in stores buying like $60 face creams and, begging their parents for this and that, which I think is quite interesting and ridiculous in my opinion, but I don't know anything about the skin. But, because skincare is so expensive and it can range and things like that. And again, with social media and just where we are in the world, like there's so much information out there and I think everybody is on social media, but at what age do you think people kind of need to start worrying about the skin, or is there kind of an age, let's say that like if you're 12, is that too young? You know what I mean? Like is there an age where you're like, no, you don't want to like touch skincare because it can harm you down the road or anything like that?
I think probably more that your skincare needs change as you go through life. So you're absolutely correct that in teenagers, they really just need very gentle skincare. A lot of the things that are unfortunately marketed to them, they don't require. But most people are going to benefit from having a general good routine, right? Like cleansing once, twice a day, regular moisturizing, and certainly sun protection, no matter how, no matter at what age you are, right? So there's certain things that are useful, I think, throughout life. Most people, I guess, it's usually in their 20s that they start thinking about things like more about active ingredients. So we've talked a lot about, retinols and niacinamide and vitamin C and antioxidants and that kind of thing. So that often people will start in their 20s. It doesn't mean they have to, but certainly it can often be very reasonable to do that. But often, your skin changes a lot over the decades. And so I think your skincare routine is going to evolve over time too. So, someone in their 40s or 50s may have very different skin concerns. The skin is often drier or and needs more hydration, might need more antioxidants, peptides compared to someone who is in their 20s. So it's not so much about there being a strict age cutoff. It's more just that your skincare needs are likely to change. Having some good habits, though, like from early on. So like I said, daily cleansing or twice daily, depending on a person's routine. Regular moisturising to help support the skin barrier and sun protection probably do need to start early on. You did mention one thing about cost, which I thought was interesting as well. I think that's probably another potential myth that that skincare has to be expensive for it to be good. I think it's worth noting that, particularly when it comes to things like moisturizers, the two most expensive ingredients tend to be the fragrance and the packaging. Yeah, so I mean, a good plain moisturizer does not need to be expensive for it to be effective. Things that tend to drive up cost are, certainly cosmeceuticals are definitely, they're much more advanced formulations now. So sometimes there are certainly additional benefits that you can get from your moisturizer. So it might have ingredients that you want to use, like niacinamide, that add value to your cream. But sometimes there'll be, quite rare or obscure ingredients like, licorice root extract or gold or, caviar, things that perhaps don't have as much data behind them and sometimes will be used by a given brand to as a point of difference. Right. But we don't always have like randomized controlled trials or data that really shows that ingredient is superior to others. So I think just being aware that there's obviously a strong marketing element too when it comes to skincare, and it doesn't necessarily mean that a greater cost necessarily has to correlate with quality. Right. I think that's worth being aware of too. Absolutely. Yeah.
Is like more better, like with those expensive skincare products that have like 20 ingredients in it, is that because it has 20 ingredients in it that it's so expensive, and is that better than one that has 2, or does the research not support that either?
Not necessarily, and you'll probably find, like, if you ever sort of studied the packet of or like the bag of skincare, I mean there often are multiple ingredients because you need so many different things in terms of I guess sometimes preservatives or things to make them safe as well, or to prolong their shelf life or safety, etc. So I think it's not necessarily about the number of ingredients, but like I said, it might be proprietary formulations, how well the brand is known, like I said, the packaging and also the proprietary fragrances that have been developed as well. So those things play a big role in terms of cost as well. So I think you can still often have a really good skincare routine. It doesn't have to cost the world, but it's about finding formulation ingredients that are good for your skin type.
Right. Yeah. What about what's overrated in your opinion when it comes to the world of like, what are things right now that is in the skincare space or just in the space of people using a certain piece of equipment or product or whatever it might be? What's a bit overrated in your opinion that you kind of, again, have to educate people? Maybe like there's not a whole lot of research around that. Why are we doing this,
I think toners is probably one of them. Like, I think that the majority of people probably don't need a toner. I mean, there's different types of toners, but if you're cleansing well, if you're using a gentle cleanser, then you rarely need a toner afterwards to help further clarify the skin. There are some toners that are more designed as hydrating toners as well. So they can sometimes have a role, I guess, in people that struggle with dryness. But that's probably an easy part of the routine that you can often eliminate in the interest of trying to streamline the routine at night. So that's probably one that I don't favour as much of. Yeah.
What about like skincare routines? Like people have a morning routine, they have an evening routine, they do like 3-step process or whatnot. And I know you mentioned like the ABCs and certain things that you need to think about. But is there any harm in doing those things, or is that something that again is overrated? When it comes to doing 5 things in the morning, 5 things in the evening, like do they need to be using like 10 different products every day, or?
Oh, not necessarily.
Okay.
I mean, for example, often the reason people have morning and nighttime routines is purely because of a difference in ingredients. So, for example, if you're using a vitamin A-based ingredients, usually that's recommended to use it at night because it tends to make the skin a bit more sensitive to sun, and it can also undergo degradation in sunlight. And then in contrast, something like vitamin C is generally used in the morning because one of the things it does, it's an antioxidant, and it also I guess, almost protects our skin cells from some free radical damage from environmental factors like, sun and pollution. It's not a replacement for sunscreen, but it can have a role in protecting the skin cells. So it's sometimes more to do with what they're using as to why there's a difference between a morning and an evening routine. But I personally really like using combination products. Often I'll just make it quite simple and, have a morning moisturiser that has a vitamin C and a niacinamide in it, So there's ways of making it easy as well. It just, and then, so it just depends. You don't necessarily need to put 10 things on your face, and sometimes no more is not necessarily better. Sometimes your skin really doesn't like that, and if you're mixing them in the wrong way, if their pH and their the formulation that they're in, creams versus oils, are not compatible, sometimes you can make things worse. But having a clear understanding of what you're using and when, and why, what you're trying to achieve with it, I think is beneficial. Yeah.
Are there any dermatologist recommended brands out there that, you or your coworkers or whatnot often recommend when it comes to things that are safe for, let's say, people that are just looking to, add a moisturizer, add something simple? Is there any brands or things that you often go toward?
There's quite a few, to be honest. Yeah. And I think you'll probably find if you, when you wander through, David Jones or the chemist even, a lot of them will say dermatologist approved or endorsed. So I think it's probably more about, I certainly do routinely recommend certain products to patients, but it is very much tailored to what their skin needs, and also a little bit sometimes to their budget as well, because you can have really good products at different price points, and some may offer additional benefits to them. So I think I don't want to sort of list X, Y brand, because there's quite a few. I'm familiar with quite a wide range of brands, and I might recommend one over the other depending on the person's needs.
Well, I think that's the reason I brought that up is because it's good. Like you mentioned that, you offer different options, whether it comes to budget or people's needs or whatnot. Because I think a lot of the times, as consumers, we might look through the aisle and say, oh, this is dermatologist recommended and it's that one brand, or it's, if this is $60 then I have to spend this money on it. But I guess it's not like that. It depends on your skin and things like that. So it's good, I think, for consumers to hear that, because I think maybe one of the factors that limit people from seeing a professional is the cost, I think, a lot of the times. And it doesn't always need to be like that. If a dermatologist is recommending based on, your lifestyle or whatnot, that's good to hear, I think. What about the active person? Sorry.
I was just going to say, just on that, it's quite interesting because I think sometimes, I think you'll be, sometimes people will be pleasantly surprised. They'll come and see you having spent, hundreds of thousands on skincare or microneedling or things that were just never really going to help their acne. And perhaps if they just, had an assessment at the beginning of all of that with a dermatologist, potentially that could have correlated with the saving, because they might have just had either some prescription treatment and a very gentle skincare routine to complement that to get to where they wanted to be. So I think having some perspective on that's useful too.
And I think I alluded to this before, it prevents from things getting out of hand as well. I don't think it needs to reach the end stage to see a professional someone like you. If you're struggling with something right away or you want to prevent something, why not have a consult, right? I don't know. That's just my opinion on that. But when it comes to the active person who might be sweating all the time or who might be outdoors a lot, what are some things and strategies that you recommend for those people that, are constantly on the move, can't really, let's say, use all of these products, or maybe are struggling with oily skin and things like that? What are some strategies that you have for those kind of people that come in to see you?
Yeah, I think it depends on what I'm seeing them about. So, because I guess one of the challenges that I see a lot of in people that are very active will be issues related to things like folliculitis, for example. So folliculitis is often related to when the skin follicles can become blocked, and especially in the chest and back, and often that can relate to things like sweat, occlusion, and so sometimes, we will have to modify some of those lifestyle factors. So, I mean, if you're exercising, that's great for your health, but showering straight away afterwards, or making sure the fabrics that you use are breathable, or if you're exercising, that's fine. Like wear what you need to wear for exercising, but then, change straight out of it. Don't then go have like coffee, lunch, and get on with your day while still in very tight clothing, for example, that's not as breathable. So it depends what I'm seeing them for, I guess, because that's probably like I said, in the very active person who's cycling to work or exercising in the morning, but sometimes having to break the making sure that they're able to still do all those things, but that things like sweat settling on the skin are not then adversely impacting on their skin health are important to sort of balance as well. And most people can find some time in their day when they can do a simple skincare routine. And like I said, there are solutions for topping up, if you're outside, to make it easier for yourself, whether that's physical sun protection rather than just relying on reapplying sunscreen, because if they're constantly sweating it off and it's not practical to feel as though that's adequate to protect their skin, making sure that they are, using other factors to help protect their skin can be valuable too. Yeah.
That's interesting. I never thought of like tight clothing and things like that, but I guess it makes sense. Like
body skin.
Yeah. Because if you're like, I don't know, in for 10 hours, or not 10 hours, that's a bit exaggerated, but for like a couple of hours in like sweaty clothes and things like that, of course that might have an effect. Or like caps or things like that. Yeah, that makes a lot of sense.
Definitely.
And I think like, again, people don't think of these kind of things, and it's important to get an assessment really. What kind of like we already alluded to this, like what you're excited about in research and things like that previously, but are there any like breakthrough treatments right now that are going on in the dermatology space, or are there any like treatments that people come in specifically to see you for? Let's say, they've Googled something and, oh, I heard about this right now. I want, like, I'm interested in this. Is there anything out there right now that's like breakthrough?
Look, it's a good question. I think it's a difficult one to answer though, because we do have lots of technological advancements in terms of, laser and cosmeceuticals, and also in terms of various like bioremodeling treatments and things too. It's hard for me to pick one, I think. I think because I sort of try to stay away from. I think when people hear things on social media, they're like, "Oh, this looks great," and therefore it must be for me. And so that's probably something that we sort of encourage people to, to try not to, because just because it's worked for one person doesn't mean it's going to be the panacea for them. Do you know what I mean?
And if you learn anything from this episode, I think that's the key point, isn't it? Right? Like,
it's the same with all those viral like TikTok skincare trends, right? Like just because this one person, who's possibly been paid has had some great result from an obscure routine, it doesn't mean that is then the right thing for you. And same with, yes, there's lots of amazing technology that's coming out or has come out, or things that I love to do and perform, but it's not as though I would that doesn't mean the ones that we've used in the past are not good. It just depends on what that person's skin is going to benefit.
But I think that, like, again, as a consumer hearing that answer and hearing, like, that there's multiple things out there, I think as a consumer who, again, is not trained in that space like me, it probably, if anything, makes us want to see someone like you more, because, we now know that there are some good things out there and not just one. Because, again, if you're, let's say, in that space of oh, okay, this, like, my friend tried this, I want to try it because it might help me, but then it doesn't help you.
Yeah.
I think that also in the long term can cause that person to just like not see you again, or like to just give up. And, to hear that there are actually, there's like multiple things out there that can help, I think is quite important for people to hear.
It is. Like, I mean, if we think about some things we've talked about today, like for example, say like a few years ago, one of the breakthroughs was about the picosecond laser for pigmentation, for example. And it can be really valuable for some people. But what if that pigmentation hasn't been assessed correctly, right? Like what if they actually have these, they might benefit more from a medical prescription treatment or cosmeceuticals instead. It really depends, or even sometimes tablets. So I think things need to be assessed properly before you can make a recommendation about what treatments they're going to benefit from. Or say with acne scarring, which I see a lot of, sometimes people, ask you by name a given treatment. But their scarring may be, it's not so that may not help at all, but realistically they probably need something perhaps that's a bit more, that's going to address the deeper scarring first. Like they might need, a procedure like subcision where we use like a needle to help release tethered acne scars or something to bring the skin up. Or sometimes we even use things like, dermal filler and things. So there's lots of different procedures available. And I think that's why, I think starting at the starting point should be a consultation rather than I want X and therefore I'm going to see this person. It's more like I know Aakriti deals with acne scarring. That's one of her things. And so I'm going to go see her for an assessment about what the options are for my skin type is probably a better way to think about it.
Yeah. No, that's super, like, I guess that's, I think, super helpful for a lot of people to hear. So, where can people find you?
Yeah. Probably most accurate to always look at my website. So it's drcreedy.com or drcreedy.com.au, and it'll always list my up-to-date, workplaces. So I'm currently at Melbourne Dermatology in Unley and at Dermatology SA in Dulwich, and also in private practice, in public at the Royal Adelaide Hospital.
Perfect.
Yeah.
Awesome.
Thanks.
So that'll all be in the show notes, everybody. So definitely check all of that out.
Yeah.
Yes. But thank you again for coming on. I think this was really insightful. It was awesome.
Pleasure. Thanks for having me, Jordan. It's good fun.
That's
Thanks.
all right.
Okay.